Hiya, today we're joined by Julie Babis. Julie is a BANT registered nutritional therapist and certified NLP practitioner. She works with people who want to reverse pre-diabetes, manage type 2 diabetes, and support healthy heart, hormonal balance, and cognitive function through their 40s, 50s, and beyond. Julie's approach is all about empowering you to make the best food and lifestyle choices for your vibrant health throughout midlife and beyond. She partners with you, putting you at the center and to ensure that you thrive no matter where you are or what you're doing. Julie, thanks so much for joining today. I'm really excited to get to speak to you.
It's a pleasure to talk to you, Sarah. Thank you for inviting me.
Great. I just want to kind of get to quickly know you a little bit and just kind of learn about what led you down the path to nutritional therapy. So you could tell us a little bit about your journey.
Yeah, my journey to nutritional therapy started with my own health journey, managing IBS and digestive issues. And now, as I'm moving through perimenopause, managing my hormones, my blood sugar balance, and planning to age in a healthy way. I have a family history of osteoporosis and heart disease, and I've been working to avoid those outcomes for myself and for my family. And both my children are competitive athletes, so nourishing them to meet their needs has also been an important part of my learning process as well.
Great. Yeah, that's something I think we've heard a lot from different kind of menopause specialists we spoke to is, when they were coming to the stage in their life, they decided that there weren't the supports available to them around them. So they kind of had to just do it themselves. And then that led to them starting their own businesses. So it seems like kind of a universal experience for a lot of women is that when they started to get to perimenopause or the menopause transition, they couldn't find the supports. Is that how you kind of felt as well?
Yes, I did feel to a degree like that. Perimenopause and menopause are natural processes. Every woman's going to go through it at some stage. And whilst there is varying degrees of medical advice available, and that's a bit of a lottery depending on where you live and how educated your particular GP is, it doesn't necessarily need to be medicalised. It's not an illness, it's a natural phase in life. So trying to manage menopause and perimenopause symptoms as naturally as possible was quite important for me, because I don't see it as a disease. And I don't think really any woman should see perimenopause as a disease. It's not something you can cure. It's not something that you can avoid. It's something that is an inevitable part of a female's life. So it's to be managed, lived with, and that's harder for some women than for others. I fully recognise that. And everybody's journey through it is going to be unique, and their choices are going to be different. And I believe every woman should be empowered to make whichever choices are appropriate for her.
Yeah, absolutely. And I think also there's maybe not as much information around perimenopause specifically as opposed to maybe menopause. Like a lot of women might not know that there's this kind of like pre-transitional phase, and also what ways you can kind of help support yourself through that journey or through that transition through like nutrition and exercise as well.
Yes, I mean, menopause is actually a point in a woman's life which is actually very, very difficult to identify. It's identified retrospectively through having not experienced menstrual periods for 12 months. So menopause itself is just one point in time. It's the journey up to that through perimenopause that can be a complete roller coaster physically and emotionally for many women. And that's because the body is going through a process of changing hormonal levels. Progesterone starts taking a holiday every now and then. That allows estrogen to become overactive in the sense that there's nothing to oppose it, or the body will produce more and more estrogen to try and generate some progesterone because it doesn't really know what to do. So it's those imbalances that tend to create many of the unpleasant symptoms that women experience, from hot flushes to anxiety joint pain, hair loss, massive appetite fluctuations. The list is actually
Goes
long and
on and on.
increasing, and the medical profession doesn't actually recognise many of the things that women experience because they're not officially on the NHS list of NHS symptoms. Also, I think there's no precise starting point of perimenopause, and it can vary from woman to woman. So some people may actually start experiencing perimenopausal symptoms in their 30s, at which point anxiety may be treated with drugs for anxiety or depression. Joint pain may be diagnosed as being some kind of arthritis or muscle stiffness, for which painkillers might be diagnosed, whereas that might not actually be the cause of those particular symptoms. And that continues all the way through to a woman's 40s, potentially 50s and beyond.
And we do a lot of kind of specific work with kind of corporations and workplaces about kind of improving access to health information and ways in which employers can kind of improve the structures in their workplaces to make them more focused on employee health. And I wonder what your thoughts are on that nutritional side of like what employers can do to kind of improve the educational access to nutritional information.
I think there are several things that employers could do. Firstly, it's make information available and training available both to men and to women. Men don't experience menopause, but they're all working with women, living with women who do. So education, I think, should be directed at everybody, not just specifically at women, because the more there is understanding in all the employees in the workplace, the more support mechanisms can be put in place and become more effective. So it's not just about making this a kind of secret set of training or information or data for women alone. It should be available to everybody.
Yeah.
Around nutrition specifically, a big thing for me in the workplace would be to see importance placed on actually eating meals. So reducing a culture of skipping lunch, working lunches, eating at desk. If you're sitting down at a table away from your work with a knife and fork, you're more likely to make healthy food choices, which, for example, having a salad as opposed to a sandwich that you can grab and go and eat on the move. Carbohydrate metabolism tends to reduce as estrogen decreases. So carb-laden foods are not necessarily the best choices through perimenopause and beyond for women. But if you're working in a situation where the buffet is sandwiches, muffins, things in packets that are easy to eat, then that might not be necessarily the best food choices available. So it's changing the culture around eating as much as education around nutrition. I think is quite an important thing employers could consider.
Yeah, definitely. I mean, having that, if something's right in front of you, you're not going to opt in for the maybe more time consuming like option of going out and getting your own lunch or making your own lunch. So it's about not even just providing the information, but also the access to it. And
Yes.
yeah, and I think also
Or
what you
having
were
a
saying,
culture where eating at your desk is not allowed. That might be more
absolutely.
appropriate than encouraging people not to take a break and to work on through their lunch breaks.
Absolutely. And also, I think also because, we're kind of at a time where people are doing a lot of hybrid working or remote working. So they're kind of tending to probably combine their lunches with like, I'm already in my kind of home office or, I only have a certain amount of time of the day. So I think it's kind of about getting people as well to have that structure of their day so that they're eating at the same time every day, and they're maybe going out to go for lunch, like go walking from one room to another, as opposed to like doing it all in the same room, because then your movement is up
Yes.
as well.
Yeah. And also, I know that where there's hybrid or home working, some employers use monitoring software to ensure that employees are at their desk or using their computer, maybe making it clear that taking a certain amount of time away from your desk during the day is expected. And that's actually being monitored through the monitoring software as well. I think would be
Yeah.
quite a positive step for many people.
Yeah, it's very important now, and we do a lot about kind of MSK disorders as well, with improper workplace setup. So I think, yeah, kind of having that lunchtime as like you're leaving your work, you're leaving your desk, you're going and you're having a meal, or like you're moving away from the workplace is really
Yes,
important.
move away from the workspace,
Hmm.
go outside and get some fresh air, eat in a different place. It's
Absolutely.
creating a mental and physical break,
And you kind of
which is important for men as well as for women. It's important for everybody, I think.
absolutely, it's important to encourage that kind of culture in the workplace, because I think things have become very blurred in the last few years. Um,
Yes, yeah.
and we kind of discussed a little bit before about your work with pre-diabetes and type 2 diabetes, and I wonder if you could explain a little bit about like the links between diabetes and menopause and how they're kind of connected.
Uh, Insulin, which I suspect most people have heard of, is the hormone that enables the body to take up sugar into cells for energy, take up sugar in the form of glucose. It's a steroid hormone, it's a cholesterol based hormone, the same way that estrogen, progesterone, testosterone are also cholesterol based hormones, they're steroid hormones as well. As estrogen levels decline through perimenopause and progesterone declines as well, it's changing the hormonal balance within a woman's body. And one of the potential effects of that is to change the way the body responds to insulin. So the body becomes less responsive to insulin, less glucose is taken up into the cells for energy, hence one of the perimenopausal symptoms of feeling tired, certainly late afternoon, mid to late afternoon. And it also means that that glucose is going to be stored, if it's not being used by physical activity, it's going to be stored in the body as fat, contributing to weight gain that many women experience as they are going through perimenopause. So, understanding how your body processes carbohydrates, how it metabolizes sugar, is quite important. And there's data emerging through the Zoe project and other large scale projects that suggests that for women in their 40s and beyond, your body is most sensitive to glucose earlier in the morning. So eating carbohydrates earlier in the day might be more appropriate than carb loading in the evening when your body is processing them less effectively. So the other effect of reduced glucose sensitivity is a tendency to move towards a pre-diabetes state, which is basically the body is being less sensitive not to estrogen, to glucose and to insulin. It's processing it differently. So there's a period during which you can learn to manage that, change your eating habits, change your lifestyle, work on managing stress if stress is an issue, because that will play into it as well through another set of hormones, through the cortisol hormones, and potentially avoid that progressing towards diabetes, which is likely to be a potential outcome if you continue to eat, if you've always eaten the carb heavy diets and continue to do so, then that's the direction in which things will move, because your hormones are pushing you in that direction. So it's a time to take stock, look at what you're eating, when you're eating, how you're eating, and make changes and become aware of how your body is reacting to different foods. For some people, using a continuous glucose monitor for a couple of weeks to see which foods specifically cause glucose spikes might be an effective learning tool. I wouldn't advocate using them long term unless that's recommended by a doctor or a diabetes specialist medical professional. But it can be quite a useful short term learning tool. Say, oh, if I eat bread in the morning, it raises my blood sugar a little bit, but not too much. But if I eat it in the evening, my blood sugar actually really goes into a massive spike. It can give some pointers as to what you should be doing differently and what might be helpful. And it can be very different for different people as well. It's we are all individuals at the end of the day. And that's one of the reasons why I practice personalised nutrition as opposed to saying everybody should be doing this, because I don't think everybody should be doing necessarily the same thing, although there are some underlying principles that hold good for most people.
Absolutely. Yeah, I mean, I think it comes back to what you were saying about just having that access to information and education about nutrition, especially when it comes to diabetes, because it's just rising in all over the world. But I think it's like 5.6 million people in the UK, and it's something that a lot of people aren't aware of, or kind of don't know. Anyone could develop it at any time, and it's some people affects differently in the same way that everyone needs a personalized nutrition. And I think a lot of people wouldn't necessarily think menopause and diabetes have a connection there, or there's a link to the two. And like you were saying, things might get misdiagnosed, or certain certain things within menopause, you might think it's one thing, but then it actually could be this other thing that then you need to also take care of.
Yes, and things tend to be very interlinked without the body. I think we're under a false impression that because of the way medicine works in this country, that everything is separate and nothing is connected. Whereas the body is one very complex machine, which is lots of different systems, if you like, all working together, hopefully in an optimal way to enable us to minimize risk of developing diseases and to have a clear mind, a healthy body, and be able to continue doing what we enjoy doing as long as possible at the end of the day.
Absolutely. And, do you know anything about, like, for maybe specific women who are going through the menopausal transition that are maybe taking HRT, whether that has an impact on diabetes as well, or if there's any connection to blood sugar levels there?
As a nutritional therapist, I'm not an expert on what is classed as medical treatment, and HRT is classed as medical treatment. But equally, I wouldn't say to anybody, don't take HRT. For some women, it's an absolute lifesaver. Some women choose to avoid it because they don't think it's right for them. Both are valid choices. One thing that I am aware of is that the modern forms of HRT, so that's the bioidentical hormones, don't have the potential massive side effects that the synthetic hormones that used to be used have. So there can be a lot of benefits to many women from using HRT, and I think it's important that everybody has the conversation with a doctor at some point to understand what's available and to be able to make informed choices as to what's right for them.
Absolutely.
And I would be equally happy to work with a woman who chooses to take HRT as somebody who chooses not to. That's the very personal choice. And it can make a massive difference in symptoms for some people.
Absolutely. And, from what you were saying earlier about, maybe having certain, like, carbohydrates in the morning as opposed to even the evening to kind of manage blood
Mm-hmm.
sugar levels and glucose spikes. What other kind of, not to say that you'd have to pick a personalized situation, but like advice would you maybe give to, women going through menopause and maybe dealing with blood sugar spikes about how to manage these kind of things and kind of ways in which you would advise people kind of balance the two?
An approach that I take, because it is very effective for many women, is to ensure that you're taking or eating a good proportion of proteins every meal, and that includes breakfast. So instead of having just a slice of toast or a sugary cereal at breakfast time, I would always recommend having a good amount of protein at breakfast time. So making sure you've got eggs are a great choice. If you don't eat eggs, something with nuts, seeds, sprouted seeds, or even having a savoury breakfast, leftover chicken from the day before, or leftover fish, or something, smoked salmon on toast, or something like that. It can make a huge difference because protein takes longer to digest than carbohydrates does. So it evens out the way your body absorbs energy over a longer period of time, and then and consequence of that is you may experience less of a craving for sweet things or a need to eat mid-morning if you've had a really good breakfast. And again, through the day, make sure you're getting some protein at each meal, some healthy fats at each meal. And in the evening, I tend to steer away from simple carbs, so potatoes, white rice. If you feel the need to have something starchy with your evening meals, then go for whole grain things, so brown rice, buckwheat or quinoa, both of which have a good protein content, a lower glycemic load than the starchier options. Those are steps that every woman can take. Increase your vegetable intake throughout the day. So aim for a minimum of 5 different vegetables during the day. Fruit is great, but it is important to bear in mind that fruit contains natural sugars in the form of glucose. So if you're going to have fruit, eat the whole fruit rather than have fruit juice, because fruit juice, you're getting a massive sugar hit effectively, and without the fibre that moderates the way in which your body will process the sugar if you eat the whole fruits. So the whole fruit is better than fruit juice. But keep the fruit to 2 or 3 portions a day alongside 5 or 6 portions of fruit and vegetables. And that might seem like a huge amount to many people. So work up to that slowly. Changes take time to become a habit. I read somewhere recently that it takes 66 days to form a new habit. So it's not going to be an overnight change. I think that some people might be able to completely alter the way they eat overnight. I think they're the minority. And for most
Yeah,
people, it is a gradual process. There will be days when you don't stick to it. Tomorrow's another day. Just start again. It's nobody's going to beat you up over it. You don't get prizes for being perfect.
absolutely.
And it's what nutritional therapists tend to refer to as the 80-20 rule, which is if you're doing well 80% of the time, then if you slip 20% of the time, your body for most people, your body will cope with that.
Mm-hmm.
It's for a few people, they won't be able to cope with that. That tends to be people who've got various chronic diseases going on, or a lot of allergy issues. But that's a whole separate topic.
Yeah. Yeah, I think
But I
as
think
well
moderation in most things for most people will actually be beneficial.
absolutely. I think, what you're saying, it's that not to let a slip up, delay the whole progress, because I mean, I guess as well, if you were going through like different transitional periods of time and on top of that stresses with work or family life, it's better to just, take one day, and if you slip up then, and then get back at it, and not, it doesn't mean that it's stopped the entire progress. It's just you have to keep going, which is hard
Yeah.
for a lot of people. I think especially now where we're kind of given a lot of instant gratification online and very addictive personalities, so it's hard to maintain things. So I think that's very, very good advice.
Yeah, and it's important to bear in mind that a lot of what you see online is very carefully curated to look perfect, and that is an imaginary world. For most of us, life isn't that straightforward, that perfect, and something I say to clients quite frequently is if you start the day well, at least you've had a good start, and if it all goes a bit pear-shaped later on, so be it. Just
Yeah.
start with the day well the following day, and maybe plan for doing things better rather than saying you go out and grab from the sandwich shop a salad rather than a sandwich at lunchtime and they haven't got any left.
Mm.
If you've been able to think about it a bit in advance and make your own to take with you, then that's less likely to happen.
Yeah.
But we all have days where we oversleep or something goes wrong or we miss the train or whatever, and it doesn't always work as smoothly as we'd like it to. But
Yeah.
incorporating small changes regularly and sticking to them and then introducing a few more is more achievable for most people than making one radical, I'm not doing
Yeah.
this, I'm not doing that, I'm going to do this, I'm going to do that, because that's a lot to process in one go.
Yeah, I think that's often what happens is people kind of overnight are like, okay, I'm changing everything. And then they're able to do it for a week, and then you naturally just slip back into old habits. And because you've already, taken too many things on at once, it's impossible to maintain them all. So you have a mindset like you've already failed, instead of then just saying, okay, I'll just start doing one thing differently.
Yeah.
So it's hard, and I'd say it's very helpful as well for people to have someone, with a lot of experience and guidance like yourself to kind of help them through that journey, because it can be very easy to give up or like fall back into bad habits.
So that's where NLP marries really nicely with nutritional therapy, is because it's the coaching aspect that enables me to work with clients to help them find their own way of doing things. Because we can all go out and do a Google search and get the education, but it's implementing that and making it realistic and achievable, and then maintaining that. And a conversation that can be useful to have very frequently is, okay, you weren't able to do that. For what specific reason? And look at what the obstacles were to doing something, and try coming up with creative solutions to move around those obstacles, which could be, for example, planning your own foods the night before and taking a salad, because if you go to the nearest Tesco Express at lunchtime and they've sold out the 3 bowls of salad that they had on the shelves, then your options are really limited.
Yeah.
Whereas if you thought about it in advance and preempted that situation from happening, then you're much more likely to stick with the changes you're trying to implement than saying, I've been prevented from doing it by something external to me. So it is a learning curve about what works. And for some people, making a packed lunch the night before might work. For other people, making it in the morning works. That's a very different, well, it's a very individual choice. So it's working with somebody to find out what works for them, and not telling somebody you must do this. Is like, okay, let's have a think about what your morning routine is. Can you see yourself fitting this into your morning routine? Can you imagine yourself doing that? What does that look like? What does that feel like? And when people start envisaging doing things, they're much more likely to do them than if they just think about it in an abstract way.
Absolutely. Yeah, no, you're very right. I think it's about finding what works for you and just not being so hard on yourself if it
Yeah,
doesn't go right. Absolutely.
yeah. At the end of the day, there's no such thing as failure. There's only a learning experience.
Yeah,
Okay, it didn't go right today. What can I do differently tomorrow to try and make it go better? It's there's no blame in that. There's no judgment. There's just analysing it, doing a little bit of reflection to see what worked and what didn't work, and moving towards what works and away from what didn't work. It's a process. It's a journey.
absolutely. Well,
It takes the
Julie,
body a long time to develop problems, and it takes time to rectify those problems, because it's not just putting a patch on the symptom, it's about modifying the underlying behaviours behind them.
100%. And I think that's why, kind of having conversations about access to information about, different health conditions and periods of time in your life where you're going to go through a transition are very important, as opposed to like maybe ignoring the problem until it gets to a point where it's gotten somewhere serious. But thank you so much for talking to you today. I feel like I've learned a lot, and now I'm kind of thinking about my own kind of nutritional life and how I can kind of make my own little improvements here and there. So it was really lovely to speak to you, and thank you so much for all your sage advice on nutrition and
Thank you.
menopause.
Thank you. It's been a pleasure talking to you, Sarah. Thank you.